This is what a DVT or deep vein thrombosis looks like. Deep vein or deep venous thrombosis is often referred to as DVT. Thrombus or thrombosis is a blood clot, and the deep veins are the large veins deep in the leg, and these are usually the popliteal, femoral and iliac veins. Deep vein thrombosis is potentially very serious, and one of the things that makes them so dangerous is that 50% of them are asymptomatic. This is because of collateral venous drainage, where other veins in the leg drain the area that the deep vein can't drain when it is blocked with blood clot. But symptoms of DVT include a local throbbing pain, edema or swelling of the lower leg, red or darkened skin, and a particularly ominous symptom is if a DVT presents with breathlessness. More about that in a moment. There are many risk factors for DVT, and these include physical inactivity, for example bed rest, sitting for too long, and long plane journeys. Damage to veins such as surgery, fractures and intravenous catheters can precipitate a deep vein thrombosis. Hypercoagulable states where the blood becomes sticky and more prone to clotting include cancer, heart disease, lung disease and autoimmune diseases such as lupus and inflammatory bowel disease can increase the risk of developing a DVT. For example, this pancreatic cancer. And also surgery is a risk factor for developing a DVT. And if you're wondering who the handsome surgeon is, it is my dad. An increase in estrogen, for example with the oral contraceptive pill, hormone replacement therapy, pregnancy and shortly after pregnancy can increase the risk of a DVT. Other risk factors for deep vein thrombosis include a previous history of a DVT or family history of DVT. People who are over the age of 60 are at increased risk. And smoking and obesity are two avoidable risk factors that can increase the risk of developing a deep vein thrombosis. And this is a picture of a chap called Daniel Lambert, who is a bit of a celebrity in Stamford in Lincolnshire. Local problems caused by a deep vein thrombosis include thrombophlebitis, where the vein becomes inflamed, and swelling of the leg. But by far the most dangerous and potentially deadly complication of a DVT is when large pieces of the clot break free, causing pulmonary thromboembolism. This is a lower leg containing a deep vein thrombosis, and one of the things to notice is that the deep veins in the leg are very large, and that is why DVT is so dangerous, because the clot formed may be very big. And if the clot detaches, this will then travel to the vena cava, which is the huge vein at the back of the body, and from that the clot makes its way into the right atrium in the heart, then into the right ventricle, where it is then pumped into the pulmonary arteries, where the blood clot lodges because it can't travel any further. Here is a piece of lung, and in the middle of the picture is a pulmonary artery that is partially occluded by blood clot caused by a deep vein thrombosis. And this is a pulmonary embolus, or PE, and this can result in either breathlessness and other symptoms of a pulmonary embolus, or more catastrophically, sudden death.